Thank you everyone for being here today on our webinar. So we'll begin now, and as we go through the webinar, if you have any questions, please feel free to write them on through the GoToWebinar platform, and we'll keep note, and we'll have a question and answer session at the end. So today we're here to talk about the recent developments in gender and climate, focusing on the Gender Action Plan, or the GAP, from a reproductive health perspective. We'll first start with an introduction to PRB, and then give some background to this webinar. Then we'll move into perspectives on COP23 and the GAP, which will be presented by Bridget Burns from the Women's Environment and Development Organization, or WEDO. Then we'll move into experiences from reproductive health advocates. And we'll have Ida Klockman from the Danish Family Planning Association, and Nagash Teklu from the PHE Ethiopia Consortium. After these presentations, we'll move into a discussion with a question and answer session. So the Population Reference Bureau, or PRB, many of you are familiar with PRB, but we wanted to start by sharing a brief overview of what PRB does and why we do it. This is the PRB mission statement. The Population Reference Bureau informs people around the world about population health and the environment, and empowers them to use this information to advance the well-being of current and future generations. Our work is organized around the three key areas laid out in that mission statement: inform, empower, and advance. To inform, we translate complex data into accessible language and visuals that can be quickly understood and used by non-technical audiences. Our role doesn't stop at handing over information, however. We also want to empower those audiences by building champions and growing their capacity. Finally, we advance policy dialogue and action by creating spaces and motivation. You can learn more about PRB on our new website, which is at www.prb.org. So this presentation is part of PRB's People Health Planet team, and I'm going to show a quick video to give you a bit more information on what we do in the People Health Planet team. Solving these complex challenges that we face today demands better understanding of how these aspects of population impact the environment, how environmental change impacts our health and well-being, and what can be done to address these issues. Through PRB's People Health Planet focus area, we aim to increase awareness among decision makers, key stakeholders, and advocates about the linkages between human and planetary health, environmental conservation, and reproductive health. We build leadership and capacity to work on and communicate about human and planetary health, including projects and research classified as population health and the environment. We conduct and share research on the role of family planning in sustainable development and the connections between improving reproductive health and key development sectors, such as climate change, resilience, food security, nutrition, and women's empowerment. We develop and support international, regional, and country-level networks and communities of practice for information sharing and collaboration on human and planetary health. So today in our presentation, we'll have, again, Bridget Burns from the Women's Environment and Development Organization, Ida Klockman from the Danish Family Planning Association, Nagash Teklu from the PhD Ethiopia Consortium, and I'm Laura Cooper Hall from Population Reference Bureau. We will investigate the UNFCCC, or the UN Framework Convention on Climate Change, and the Gender Action Plan, or GAP, from a reproductive health perspective. So to give a bit of background, the UNFCCC, or the United Nations Framework Convention on Climate Change, sets an overall framework for intergovernmental efforts to tackle the challenge posed by climate change and recognizes that the climate system is a shared resource whose stability can be affected by industrial and other emissions of carbon dioxide and other greenhouse gases. This is from the UNFCCC itself. The ultimate aim of the convention is to prevent dangerous human interference with the climate system. In doing so, it aims to stabilize greenhouse gas concentrations, to enable economic development to proceed in a sustainable manner. Since it entered into force in March 1994, 197 countries have signed and ratified it. The Conference of Parties, or COP, meetings are held annually as the supreme decision-making body of the UNFCCC. It is a 2-week conference with 2 physical zones accessible to specific actors. The green zone is open to the public, and within it, various organizations, groups, and businesses have their own stalls where they disseminate information and hold small events, as well as larger conference rooms where side events are held. The blue zone, however, is open only to those with approved access. It is a formal zone where negotiations take place and approved organizations and groups, public and private, are allowed to advocate and hold meetings or side events. All states that are parties to the UNFCCC are represented at each COP, where implementation of the UNFCCC is reviewed and decisions are made. The blue and green zones are the names that were given at one of the conference's parties, but these names can change. However, there are the 2 zones are always implemented at each COP. So the Gender Action Plan, or GAP, on Tuesday, November 14th, 2017, was the first ever Gender Action Plan to the UNFCCC, and it was adopted at COP23 in Bonn. Its overall goal is to support and enhance the implementation of the gender-related decisions and mandates so far adopted in the UNFCCC process through a set of specific activities to be conducted within the next 2 years. It's the first ever GAP, and it seeks to advance women's full, equal, and meaningful participation and promote gender-responsive climate policy and the mainstreaming of a gender perspective in the implementation of the convention and work of parties. It contains 5 priority areas with activities that will drive the achievement of its objectives and timelines for implementation between 2018 and 2019. Now, reproductive health and family planning in the COP space. I'd like to give you a very brief history of reproductive health in the COP space, and Bridget will give you a few more details as well. In COP15, there were the Development and Climate Days that happened parallel to COP, and in those climate days, there was an event organized by UNFPA titled Population Dynamics and Climate Change. It was UNFPA-led advocacy on reproductive health. There was also a UNFPA report on facing a changing world, women, population, and climate in Copenhagen. In addition to all of this, there was a joint Health and Environment Alliance, or HEAL, and Healthcare Without Harm delegation to the COP15. In COP16, there was work on behalf of youth. There was the Global Youth, a policy statement stating global youth support SRHR for a just and sustainable world. This was work done by Gohoven and COI, or the youth conference, but otherwise health was not linked in the COP space. There was, however, the issue of human health brought up by the C Trust Institute and Nurses Across Borders as a side event to the conference, focusing on the issue of climate change adaptation strategies. There were other side events as well by the Health and Environment Alliance and the Ministry of Health of Mexico, which included the WHO head of delegation to the UNFCCC. At COP17, there was a side event on Healthy Women, Healthy Planet, focusing on women's empowerment, reproductive health, and climate change, led by the Aspen Institute. At COP18, youth advocates continued to advocate for SRHR inclusion. Then at COP20, in lead up to COP20, Aspen Institute held another side event leading up to COP, focusing on linking reproductive health, food security, and climate change. And there was also a PAI event on making the connection, population dynamics, and climate compatible development. At COP21, there was a side event by the Population and Sustainability Network, which included one of our speakers, Nagash Teklu, which focused on breaking the silos for a healthier planet, addressing reproductive health matters to build climate resilient communities. Then at COP22, there was the most recent COP that happened last year. There was a statement from ARROW and partners on women's sexual and reproductive health and rights, which was also work, and there was also work by IPPF and PS and the Population Sustainability Network in lead up. There was also an inclusion of reproductive health in the women and gender constituencies' key demands. So as you can see, reproductive health advocates have covered a number of different positions within the COP space. There has been work done by youth, by different UN agencies, and then by different NGOs and NGO networks. And now we'll go into a bit more detail led by Bridget Burns from the Women's Environment and Development Organization on health and gender in the UNFCCC.
Okay, thank you. Good afternoon, everyone. It's afternoon. I'm here. I'm actually in Bonn at the latest climate negotiations. And I'm in a tiny little room, and hopefully there won't be any feedback, but do let me know if there is. And I wanted to just start by apologizing that I'm going to have to leave our webinar a bit early because we have a side event starting on the Gender Action Plan, so it's actually good timing in a way, and there's a lot of conversation happening around these issues. Just a little bit about what we do as an organization. If you're not familiar, we are a global women's advocacy organization founded in 1990. Really by a group of incredible women leaders and visionaries, from Bella Abzug to Wangari Maathai, who were looking towards the first Earth Summit and seeing not only were women not represented at the negotiating table, but that women's rights issues, including issues of sexual and reproductive health and rights, were not included in the discussions and in the advocacy. And if you look back to the Women's Action Agenda that was formed over 25 years ago, clearly there was always a really profound articulation of the importance of sexual and reproductive health and rights within the context of talking about women's rights in the environment and working towards a peaceful and healthy planet. If you go to the next slide, just to extrapolate a bit more on the work that we've done for the last 25 years, it's centered around two specific goals. One that focuses on women's opportunity to claim their rights as decision makers, advocates, and leaders, particularly on issues related to environment and sustainable development. And that goal lends itself towards a number of the projects that We Do runs, the coalitions that we're part of, whether it's the Women and Gender constituency here at the UN climate negotiations, the Women's Major Group at the Sustainable Development Goals or as part of the Sustainable Development Goal process, running trainings, capacity building, mobilizing resources to make sure that women activists from around the world, grassroots women, covering a range of issues, but really interested and focused on this intersection with environment, can be in these policy spaces, speak truth to power, host press conferences, define policy positions, and we have been actively doing this in the context of the UN climate negotiations for about a decade now. And our second goal, which is very much much interlinked to the first is not only making sure that women are present in these spaces, and not just women, but of course women of all their diversity and in all their forms, and feminists coming with a feminist perspective, but that we are looking at sustainable development policies, plans, and practices in gender responsive, environmentally and socially just ways. And so that includes doing a lot of technical advocacy into policy spaces like the UNFCCC, the Green Climate Fund, spaces that deal with desertification, disasters, urban cities, transport, etc. So just a little bit, there is a very unique and long now history of work that's been done to try to integrate gender considerations. And we often talk about gender mainstreaming in the UNFCCC, but I actually think we've really just started the process of doing true gender mainstreaming in the UNFCCC. I think the work that's been done over the last decade or so has been to ensure that gender and gender analysis is being considered in the decisions of this process. I would say that the path to where we are now, which is, as Laura said, is to have at COP23 a decision on a gender action plan, which is set to last the next 2 years. There was a lot of technical advocacy work, and I will say that we saw a shift in this convention around 2007, where parties moved a little bit away from the technocratic top-down approach to this being a convention about greenhouse gases, to this being a convention about solving climate change and the need for social issues to be addressed within that context. And there was a lot of work in the lead up to what was thought of as the first, what was going to be the Global Climate Agreement at COP15 in Copenhagen. Trying to understand the language of the convention, of the different pieces and streams that were supposed to make up a decision at COP15, and really doing work to make sure we could get language on gender and women's rights included in that. When we weren't able to achieve a decision at COP15, even though we didn't have the outcome that we had hoped for, the documents in the lead up to the Copenhagen COP15 decision, I think at one point, the superfluous decision, which was around 200 pages, had around 50 references to gender and women's rights. And so there was a lot of groundwork that was laid for further decisions that happened at later COPs that did include language related to gender issues. This technical work, of course, finding out which language would work, was only made possible through influence, such as training, events, working with delegates, trying to normalize and build capacity on what the understanding of what the links between gender equality, women's rights, and environment were in this process, and then normative shifts really in the political will of parties. I will say that when I first started working in this space, it was very, very challenging to talk about gender. It was seen as a side issue. It was definitely a soft issue, and there were not many parties. In fact, most of the original champions of gender in this process were a few Nordic countries, and then a few very, very strong developing countries who saw this as critical to their development and to the work that they did on climate change. There's a really detailed history, and this I know that Laura has put as a handout. We have a pocket guide on gender equality, and this is also available in French. And so if you want to go kind of through the detailed history of the different decisions under adaptation, finance, and mitigation that have included gender, you can find that in the pocket guide. And so I thought it was interesting because one of the things that I know that Ida and Nagash will probably speak to is what are sort of the opportunities but also challenges to normalizing and including sexual and reproductive health and rights in both the dialogues and also in potentially the decisions of the UNFCCC. I think from the technical negotiation aspect, one of the things to understand is just how challenging and how long of a process it's been to get language on gender in the negotiations. And still we have some very contentious discussions around language such as gender equality and human rights being included in the text. We still, just as recently as last year, had negotiations where some parties were calling for language on gender equality to be weakened to language saying just gender, or that if we talked about gender equality, we had to add language that it would be within the context of national circumstances. So there's still not particularly a strong acceptance across all parties, and the language is still very contentious in this process. Similarly, health has also been an issue that hasn't been well reflected in the negotiations, although there is growing understanding and a lot of some of the things that Laura pointed out in her presentation. I remember in 2010, in the lead up to COP16, which was the COP that happened right after Copenhagen, there was a Friends of Health coalition that was launched. I remember having a meeting with them in Bonn where they were talking about feeling a bit behind in terms of the work that had been done to try to integrate language on health into the Copenhagen Accord, or into the outcome of Copenhagen. And so there was a feeling that health was not significantly recognized within the text of the negotiations. And the first explicit reference to health only came out in one reference out of the COP16 outcomes in relation to adaptation support. And then I think that one of the big entry points for health in general is that there was an inclusion of the right to health in the Paris preamble. And I know originally this call for health to be included in the preamble was led by Switzerland, and again, some strong lobby and advocacy. But you can see that even there, whereas for many of us, there's a clear and distinct link between climate change and health, that it's still challenging to get health recognized as an issue within the context of climate change. Although in the context of adaptation, it might not be reflected as much in decisions, but it's certainly reflected in the capacity building discussions and in the work of the convention. And just yesterday, the WHO held an event here talking about the climate negotiations and the Paris Treaty as the greatest public health treaty that exists in our world, which I don't think is false to say at all. Next slide. So just briefly, I have two more pieces to then hand back over to my other colleagues to extrapolate a bit more. I think some of the challenges for sexual and reproductive health and rights in the context of the UNFCCC relates first of all to the reality of what kind of process the UNFCCC is, and also with the trajectory or the advocacy goal of having actual language in decision text to reflect sexual and reproductive health and rights. I often talk about the UNFCCC, even if there has been a bit of a shift where social issues are now understood, and certainly with the decision on the Gender Action Plan, we're seeing a huge shift in the political will to understanding gender in the context of climate change. But in reality, this is still quite a carbon metric and in very, very much compromised space. It is a space where decision making is done by consensus, and so there's very limited scope for a progressive outcome. It's not really a space where you often see, I should say, the lowest common denominator is what gets achieved in terms of the overall goals. I think we're very, very far off from having actual language around sexual and reproductive health and rights included in the negotiations. But I think that there is potential progress in terms of working along these intersections of health and women's rights and gender, to sharing knowledge and information that normalizes and helps to make sure this is integrated in terms of national implementation. So next slide. I think the real entry points and opportunities for sexual and reproductive health and rights are in three different aspects. One is to really use and look at the Gender Action Plan, which calls for activities such as workshops, non-formal training and education, working in gender budgeting at national level. There's going to be more and more of this training that's happening, and more countries are needing to create an integrated approach to how they're doing, for example, their gender budgeting and how they're linking different issues that they already work on. And so I think at national level that SRHR professionals can use the Gender Action Plan as a way to link to and integrate into nationally determined contributions, NDC, and also national adaptation plans and processes to make that link with SRHR as a critical intersection to promoting women's rights and gender equality. I think in the last two pieces, they sort of fit together, but I think, of course, ongoing education and clarity on rhetoric and also what we mean when we talk about the intersection between SRHR, environment and climate, particularly as I think Ida will speak to, moving us away from a more population control narrative that has unfortunately been the most prevalent narrative prior to this in the climate negotiations. And I also think that beyond building that education more broadly, there is still work even within the women and gender constituency where we have advocates coming from many different spaces and not all having a very strong background in SRHR, to building the education among women's rights advocates in this process. I think it was a really important step that this became a key demand of the constituency. And I think further education in helping to explore the key advocacy points and the ways of key discussion points and the ways of talking about this issue in relation to national implementation and climate action will be hugely beneficial in the long run. So I will leave it at that, but as I said, I won't be able, if there's going to be questions at the end, but I'm always available to Laura in case something comes up that I can email an answer to.
Great. Thank you very much, Bridget, for that very comprehensive overview of how gender's been included and health and reproductive health in the COP and UNFCCC space. As Bridget mentioned, you can find the pocket guide that to gender equality in the UNFCCC linked to this webinar. We've also made sure that the link is included in the comment section, so you can access it through that way too. Now we'll move to Ida Klockman from the Danish Family Planning Association. Ida, you're welcome to begin.
Hi, Laura, can you hear me now?
Yes, thank you, Ida.
Excellent. Thank you so much for the introduction. Yes, so I am Ida, and I work as an international advocacy officer with the Danish Family Planning Association, which is the Danish member association of the International Planned Parenthood Federation. And as a start, I also wanted to say that I'm the coordinator of the Population and Sustainable Development Alliance, which is an international network of CSOs from the global North and South who advocate jointly for intersectoral approaches to sustainable development in terms of advances in sexual and reproductive health and rights, gender equality, climate change resilience, and environmental protection. So in my presentation here, I want to speak to three issues. First of all, I'll talk a little more about the interlinkages between SRHR and climate adaptation. To those of you who might be new to this, thank you, Bridget, for already mentioning a little about this, but I'll go further into this. Secondly, I want to say also a little about the current status of SRHR in climate change policies at the UN level. And finally, I'll also touch upon some of the entry points and ways to advocate for SRHR to be integrated in a climate change context with a specific focus on the gap. And as Bridget has just mentioned, there's quite a long way forward for SRHR to be included in negotiations, but I will focus on other issues in that relation. Next slide, please, Laura. Thank you. So first of all, I'll explain a little about the interlinkages as we work with them in the Danish Family Planning Association and in the Population and Sustainable Development Alliance. So basically, we are advocating for the reasoning that when a girl or a woman has bodily autonomy and when she has access to sexual and reproductive health services, such as modern contraceptives, safe abortion, evidence-based knowledge and information, and when her sexual and reproductive rights are fulfilled, then she decides for herself if she wants to have children or not, and if she wants them, then how many does she want, with who, and when, and so forth. And this ability to make this decision by herself, as opposed to having a husband, parents, or others make it for her, has an overwhelming impact on her right to education, her rights to health, her job and income opportunities, her equality to male counterparts, her mobility, and a whole lot of other dimensions of her life. And all of this makes her more resilient and improves her ability to adapt to the effects of climate change. So basically, SRHR is a goal in itself. The sexual and reproductive health and rights is a goal in itself, but also a means to achieve sustainable development across the 3 spheres. As you can see from the slide, I added population dynamics in a parenthesis, indicating that SRHR and gender equality and women's empowerment also has an impact on population dynamics. Because when girls and women decide for themselves, they can have the number of children that they have the social, economic, and environmental resources to take care of, and the number that resonates with the context that they're in, which then again improves their resilience and ability to adapt to the effects of climate change. Just to indicate the potential of SRHR in a resilience and adaptation context, I can tell you that 214 million women currently have an unmet need for modern contraceptives, leading to 89 million unintended pregnancies every year. But as Bridget, I completely agree with Bridget's point about population and the wording and framing on this. And I do believe that whether or not population dynamics is relevant to the specific context that one operates in, one can use these arguments or choose not to and focus solely on SRHR and gender equality. But in total, our main aim from the DFPA and the PSDA is for SRHR and family planning to be recognized as a climate adaptation strategy, and that should be eligible for climate adaptation funding. Next slide, please. Turning now to the second focus of my presentation, and focusing in on especially the Paris Agreement. There are no references to SRHR and family planning in either the Paris Agreement or any COP decisions, as Bridget mentioned. There are, however, references to gender equality and women's empowerment, human rights, and the right to health in the Paris Agreement preamble. And next slide, please. And there are multiple reasons for that. First of all, as I see it, there's a massive resistance towards girls' and women's abilities to decide over their own bodies, which is massive, especially within the UN, and especially within the last couple of years, where new opposition has emerged, including those who also side with climate change skeptics. Here I'm specifically thinking of the US government policy and the decision to leave the Paris Agreement, which have affected the policy and advocacy space significantly. I also believe that part of the reason for SRHR and family planning not being included in COP decisions or Paris Agreement is the lack of knowledge around the interlinkages that I just outlined, and not least how to deal with these interlinkages. And this lack of knowledge is something that I see within the SRHR community as well as within the climate change community. I also believe that even if relevant stakeholders have the knowledge about these interlinkages, there are massive silos between sectors, meaning that SRHR is thought of as a gender a health issue and not as a climate change issue. And so the thinking is often that the proper sector stakeholders should take care of SRHR, indicating that the climate change sector should not. And then finally, there are these different ways of reacting to the issue of population dynamics that can be somewhat problematic. First of all, there are those who are genuinely worried about the rhetoric around SRHR in a climate change context. This is what Bridget mentioned as well, because it touches upon a troubled past and even present, unfortunately, of population control. This is a rhetoric that refers to forced sterilizations and one-child policies, etc. And some of these people are completely opposing the discussion about interlinkages, which I think is can be problematic, even though I completely understand where they're coming from. Then the second group of people are those who the first ones refer to. So people who actually believe that high and rapid population growth is the key reason for social, environmental, and economic problems. In its most extreme form, their rhetoric essentially blames poor people for having too many children. Disregard the fact that in a context of environmental sustainability, it's the rich people who are the reason for climate change. Disregard the fact that a person living in Denmark emits many times more greenhouse gases than that of a person living in Uganda. And disregard the fact that people living in poverty have more children than people living in prosperity for many various reasons, including poverty, lack of rights, etc., etc. And then finally, there's us, I guess, meeting the agenda of population dynamics head on and forcing human rights upon it. We do this because we fear that if we shy away from this agenda, then the people who make everything about population win, because the population growth rates in some countries are so massive that they might make policymakers desperate enough to take these human rights violations into consideration. Next slide, please. So even though we don't have SRHR references in the UN climate change documents, we still have opportunities to advocate the case of integration of SRHR in a climate adaptation context. Again, as I just said, gender equality and women's empowerment, human rights, and the right to health is included in the Paris Agreement. And with the Paris Agreement, we also have a standalone goal on adaptation, which is also a key entry point, or key potential entry point. Sexual and reproductive health and reproductive rights have been included in the 2030 agenda, which in itself recognizes interlinkages between the three dimensions of sustainability, and which has its own follow-up and review mechanisms at national, regional, and global level that can be used. PSGA members are attending the high-level political forum again this year in New York to call for recognition of interlinkages between SRHR, gender equality, and the SDGs up for review. We also have a burning platform for all of us, including the climate change community, in the fact that recent population projections state that we will increase from 7.6 billion people in 2017 to 11 billion people in 2100. And now we also have the gap, which is super helpful. Next slide, please. Because now that with the gap, we have multiple new institutional setups within the UNFCCC that can be utilized and should be utilized. The slides, this and the next slide outline how we can apply SRHR to 4 out of 5 priority areas under the gap. So under priority area A, we have the ability to engage in capacity building of parties and stakeholders on the interlinkages. So we can explain to them that SRHR is key to gender equality and climate adaptation. And we can submit technical inputs and engage in dialogue on how SRHR is key to gender equality and women's empowerment, and how it might be integrated as a component in policies and plans. For priority area C, we can advocate for coherence to be ensured between UNFCCC and UNFPA, WHO, UN Women, and other relevant agencies. And we can push for coherence between sectors, and we can share evidence from the ground about successful integration of SRHR in adaptation interventions. That is something that Nagesh can speak more to when he is given the floor next. Next slide, please. Under priority area D, we can engage in dialogue with the Standing Committee on Finance and use that space to raise the issue of allowing for SRHR components and programs to obtain climate finance. And as priority area E, we can engage in development of national adaptation plans, NDCs, and other policies, plans, and budgets, and advocate for them to incorporate population analysis and SRHR perspectives. I think that is my points for now. As Bridget mentioned, I'm also happy to engage in more discussions about this, both during and after the webinar. So thank you for listening.
Thank you very much, Ida, for that really interesting and thoughtful review of the gap and the space for reproductive health advocates and SRHR advocates. Now we'll move to Nagesh Teklu from the PHE Ethiopia Consortium, and Nagesh will speak to his experience participating in these spaces, in the COP space and with the UNFCCC. So, Nagesh?
Yes.
There you are. Hello.
Hello. Yeah, I am Nagesh Teklu, as mentioned. I am the Executive Director of Population Health Environment Ethiopia Consortium, which is a consortium of 66 member organizations who are implementing all over the country, like organizations Pathfinder, Engender Health, IPAS Ethiopia, and conservation organizations like Melka Ethiopia, Ethiopian conservation organizations who are working all over the country are our members. So PHE, the approach we initiated from the beginning, how we contribute to sustainable development by bringing the linkages, addressing the linkages of social, economic, and environmental issues. At the same time, my consortium is the chair of all NGOs registered in the country. We are around 3,000, and many of them through their representatives, be it through the consortium they are members, or as a group they can represent. We have a platform called the Ethiopian Charities and Societies Forum. PHE, through myself, chairs that platform. So we are an organization highly engaged on all components of issues, be it social, economic, and environmental. Continue. Next. So the reason we are engaged in developmental issues is that we thought our country, our continent, and our planet lacks comprehensive approach into development. So we are engaged in issues that need real attention. From our perspective, in the Ethiopian context, the social issues are really undermined when it comes in relation to climate change. Many of the climate scientists, the climate initiatives they try to address only the environmental impacts or sometimes the economic impacts. They don't address the social impacts in a right way. But if you take, for example, climate impacts in our country, majority of the climate impacts are affecting women, are affecting the health of the people, are affecting the population dynamics we have in our country. So in the context of Ethiopia, where it has now overpassed 100 million population size, which is the second in Africa, without addressing the population dynamics, we cannot have a sustainable climate mitigation or adaptation mechanism. So whenever we engage ourselves in climate negotiation, we realize that these social issues are very critical to the core. If we are looking for improvement of poverty, improvement of our living condition in the context of Ethiopia as an example, it represents for developing countries. In general, our planet, without addressing the social issues in a right way, we won't achieve what we are expecting. So since our participation in COP15 in Copenhagen, we analyzed how is the social issues being incorporated in the climate negotiation. We couldn't see in a meaningful way the climate issues are being incorporated with social issues. The gender issue, it was not an agenda anywhere. When I start participating in COP15 in Copenhagen, no one was bringing the issue of health, the issue of population, the issue of gender in a meaningful way incorporated in the negotiation process. So being a member of the government delegation, as a member of networks like IUCN, PSDA, PACJA, CAN, or WIDO, we couldn't see those issues are well addressed. So it is with special invitation by PAI that time I attended the COP15, and it was really important we start networking ourselves so that we can raise the issues in a way we impact the process. It is starting COP15, my organization has started working on this. And to do that, the best way, entry point was how we inject the policy of our country, how we inject the government of Ethiopia taking the gender issue, the health issue, the population issue in their negotiation process. So being a member of the government delegation was a big plus to initiate the entry point, how our government can take those issues into consideration. Next. So as a member of the Ethiopian delegation to bring sustainable development in the context of Ethiopia, to see how climate is really addressed in a right way. The Ethiopian delegation, the Ethiopian policy, the Ethiopian direction need to incorporate the gender, the population issue, the health issues incorporated in the strategy of the country. Well, thanks the growth and transformation plan of the country incorporates those agendas beautifully, but when it comes in the negotiation process, it is not strongly reflected in the negotiation process. It is not well injected. So as a member and champion of the PHE family, we strongly start advocating within the delegation the importance of this issue in bringing in the negotiation process where Ethiopia is actively playing its role. So advocating for the integration of population dynamics, sexual and reproductive rights into climate change is to the advantage of Ethiopia's sustainable development. It is to the advantage of Africa's sustainable development. Why? Without addressing the woman issue in the context of Ethiopia, without addressing the population growth we have, where it's not a productive population we are increasing. We have above 5 million, for example, in the Ethiopian context, we have above 5 million vulnerable children. It tells you those vulnerable orphan children, they are the product of the population dynamics where the economic development is not complementing the social component, is not harmonized. So a mother who has 9 children, if she cannot feed them, if she cannot send them to the school, they are forced to be orphans. What does it tell? It tells the climate impact of the country is affecting the living of our people. So Ethiopia, to achieve its sustainable development, without addressing how those orphans can be productive, it cannot achieve its growth and transformation plan, its sustainable development plan. So it is must how you incorporate, how you address the gender, the population dynamics, the health condition of the people in a way the adaptation and mitigation of climate change is addressed or given attention. So to achieve those things, having networks, partnership with organizations who have similar objective, be it at country or outside the country, is crucial point to push the issue not only at country level, but also at continent and global level. That's why when we plan to be part of the climate negotiation, it is with clear objective how we strengthen our network, our partnership, in a way we positively impact the process so that the social issues, the population, the gender issue, the sexual reproductive health issues are correctly given attention and addressed in the process of negotiation. Next. So to do those things, since COP15, we have been organizing side events where we invite government delegates, high-level officials, advocates to pass their message and their understanding and on the how they understand on the linkages. So we had side events which were new to the COP negotiation processes. We didn't had much information or events that were addressing on the linkage. So through the partnership we created in all the COP meetings, starting COP15, we started to organize and invite media, be it national media or the international media who attend in the negotiation. We disseminate different kinds of materials, advocacy materials, and we also organize important meetings and raise questions to important personalities, how they understand the linkage, how they are addressing, how they will achieve without addressing the social issues as part of the adaptation and mitigation. So whenever we plan to participate, it is with clear objective, with clear message, with clear gap to fill in the negotiation process, be it as a part of the government negotiation or as part of the different networks we are partnering in the process. Next, please. We have been also serving as a panelist in the platforms where our different governments organize, international partners events, TV shows, so that we can pass our message on the importance of the linkage, on the importance of integrating the social issues into the climate negotiation process, on the importance of addressing gender, sexual reproductive health as part of the climate adaptation. So through our media briefings, advocacy materials, and face-to-face discussions, and even having booths that we distribute, publications that address on the linkage. From time to time, we were bringing the issues. But in addition, organizations like the WHO, UN Women, UNFPA were also positively developing or increasing their engagement, which has positively contributed to bring the issues into focus. Next page. So from this whole process, we have seen positive things coming. As an example, I can mention in the Ethiopian context, we have, for example, a new forest strategy, forest policy. Before, it was not incorporating the issue of health, the issue of population, the issue of gender in the policy document. But now, they have incorporated. If we are really to sustain our forest without addressing the gender perspective, without addressing the population dynamics perspective, without addressing how women could have rights on their sexual reproductive health rights, they cannot sustain the forest of the country, which is highly declining from time to time. So if we want to save our forest, bringing the social issues integrated in the economy, in the environmental, like the forest, like the REDD+ projects we have, like the sustainable land management programs we have, like the different strategies the country is applying, be it in agriculture, be it in forest areas, without bringing the population issue, without bringing the gender issue, we won't have a real sustainable development. Equally, if our planet is planning to achieve a sustainable climate adaptation, a resilient economy, a resilient country, it should initiate how we could have a climate smart family everywhere, be it in Ethiopia, be it in South Africa, in Indonesia, in India, or in Denmark, to have a genuine sustainable living. It is must to have a smart a climate smart family that incorporates not the environmental issues, not economic issues, but also that could integrate social issues like having sexual reproductive rights fully, like having the gender equality and equity at family level, like having a balanced family size that could be managed with the economy you have. So my belief, the next focus in regard to gender, you cannot separate it from the sexual reproductive health rights. You cannot separate it with having a balanced family size that is integrated into healthy economy, healthy development, where you can have a productive citizen. So the gender action plan, if it is to meet the sustainable development target, it needs to be incorporated or integrated into economic, environmental, social, which the principle of sustainable development demands. So we need to have a capacity building, knowledge sharing, and communication in a way we address this integration to happen starting at family level. In a way we can have a climate smart family, a climate smart village, a climate smart district, a climate smart city, country, and continent. In that context, gender balance participation is so crucial. The coherence in bringing the social, the economic, the environmental should be the focus of the negotiation. If negotiation is only to happen to save the forest, the water, the land only, without addressing the people in their full participation, healthy participation, we want to have a genuine development. So in that perspective, gender sensitive responses and means of implementing monitoring and reporting mechanisms need to have the comprehensive, inclusive approach. It is from that perspective, all our projects in Ethiopia that are being initiated try to fulfill this perspective, but we are not getting the real support we need to get from the negotiation. We are not really complemented in a right way. Our mothers, take for example, in the developing countries in Ethiopia, majority of the women who are within the list of unmet needs are in our country, but climate funds are not addressing their concerns. So if our planet is to be saved in a right way, to have a sustainable development, addressing in an inclusive way, be it in the negotiation, be it in the implementation, be it at country strategy, is crucial, timely, and in that perspective, even UN organizations like UN Women, WHO, UNFPA, they need to coordinate their activity, how they can really meaningfully collaborate with initiatives like us, how the social issues can be incorporated into the economic, into the environment, where a healthy family with healthy environment can happen, can exist. And this is my strong message and what I can share. If you have more questions, I am happy to address. Thank you.
Okay, thank you, Negash, for that wealth of information that you shared on your experience in these spaces. So unfortunately, because we're already a little over time, or 10 minutes over time, I don't think we'll have time for any questions. But if you have had any questions and haven't written them on the question bank, or so if you have questions, please feel free to send them on to me, to my email at lcooperhall@prb.org, and I can send your questions on to the respective speakers that you have them for. Thank you all for your patience and for attending this webinar, and for staying past the 9 a.m. end point. We really appreciate your listening. Just to remind you a bit of PRB's work and the People Health Planet's work, one of our most recent publications is included as a handout, focusing on reproductive health and climate and adaptation finance. Thanks again, and please do reach out if you have any questions.